Today, let's continue discussing Jena and Worsham's random acts of medicine. This is the fourth part of the interpretation. Back in primary school, higher authorities would often visit for health inspections. We were always notified in advance, and the school would organize us to clean up. We worked with great enthusiasm, as if there was a real sense of purpose. As a child, I considered these pre-inspection cleanups a serious activity. However, by the 5th or 6th grade, I became cynical. I thought, isn't this fake? Shouldn't the state of hygiene in a school be evident in everyday practices? Shouldn't inspections be unannounced? But as I grew older, I gained a new perspective. Perhaps those inspections were intended to ensure our hygiene standards. If the leaders never inspected, our hygiene would likely not be good. In reality, leaders didn't care about our true standards. They weren't observing us like scientists studying wildlife. They aimed to influence us. As long as their inspections were frequent, our actual standards would be good enough, wouldn't they? With inspections from higher authorities, people tend to work harder, a phenomenon observed worldwide. As early as 1924, a famous experiment took place in an American factory. Researchers intended to examine how the brightness of lighting affected workers' efficiency. They increased the lighting and found improved efficiency. Surprisingly, when they decreased the lighting, efficiency still increased. The researchers realized it wasn't about the lighting. It was the mere presence of someone observing that boosted efficiency. This phenomenon of working harder when someone is observing is now known as the Hawthorne Effect, named after the factory where the initial study took place. Do doctors also experience the Hawthorne Effect? Yes, because doctors are humans too. Yet, after reading about the Hawthorne Effect among doctors in this book, I find myself admiring this group. Let's delve into it. Firstly, doctors make many mistakes. Besides diagnostic errors, they can make operational mistakes during treatments. Instances like leaving surgical instruments inside a patient, transfusing the wrong blood type, or even operating on the wrong limb have occurred. These errors are avoidable. Mistakes that lead to medical accidents due to avoidable errors are called adverse events. Some are due to personal negligence, while others may result from systemic issues within the hospital, making accountability challenging. However, they are all quantifiable. For example, a statistical analysis in the early years found that all hospitals in New York State experienced 98,600 adverse events in 1984, with 13.6% resulting in patient deaths and 2.6% causing permanent disabilities. By 2000, a study estimated that preventable medical errors in the U.S. led to 44,000 to 98,000 deaths annually. This is alarming. Patients entrust their lives to hospitals, and causing death due to avoidable errors is unacceptable. People make mistakes. We can only strive to reduce errors as complete elimination is impossible. One way to reduce errors is through inspections. The U.S. has the Joint Commission, which conducts surprise inspections on various hospitals. They don't give advance notice. They show up unannounced and inspect for a full week. During this week, inspectors observe doctors to see if they adhere to standard safety procedures. Inspections are sudden but public. All doctors in the hospital know when the inspectors are coming. How will the doctors behave? To what extent will the Hawthorne Effect influence them? Our most intuitive guess is that doctors would pay more attention to things they usually overlook. For instance, hand washing. If doctors strictly follow the regulations, they would have to wash their hands multiple times a day. A tedious process. Perhaps, at times, they might skip it if they think it's unnecessary. But with inspectors present, they might comply. In 2006, a study in Germany investigated hand-washing habits among doctors in intensive care units. Going undercover as doctors, researchers found that actual hand-washing frequency reached only 29% of the required times. When the researchers observed as inspectors, hand-washing compliance rose to 45%. A classic Hawthorne effect. Jena and his colleagues used the Joint Commission inspections as a natural experiment for a large-scale study. The commission discloses the hospitals they inspect and the timing. This allows a comparison of medical conditions during the inspection week with those 3 weeks before and after. First, ensure the data is clean. Statistics show that patient characteristics during the inspection and non-inspection weeks are similar, indicating that hospitals don't selectively admit easier-to-treat patients during inspection weeks. Additionally, the researchers excluded the influence of holidays from the data. The results are as follows. For patients admitted during non-inspection weeks, the average mortality rate within 30 days is 7.21%. For patients admitted during inspection weeks, the corresponding mortality rate is 7.03%, a difference of 0.18 percentage points. Adjusting for the tiny differences in the characteristics of admitted patients, the adjusted difference in mortality rates is only 0.12 percentage points. Moreover, for large academic hospitals like those affiliated with medical schools, the difference is more significant. These hospitals prioritize their reputation and thus inspections. For non-inspection weeks, the patient mortality rate is 6.41%, compared to 5.93% during inspection weeks, with a statistically adjusted difference of 0.38 percentage points. Both differences are small, but statistically significant. Keep in mind that Jena's sample spanned 1.75 million medical records from 2008 to 2012. Considering the vast number of patients in all hospitals, the discrepancy in death rates between inspections and non-inspections is noteworthy. So, doctors do experience the Hawthorne effect. However, the difference in mortality rates doesn't reveal where the Hawthorne effect manifests. Is it because doctors become more diligent and patient, or is it challenging to study since we lack comparative data on doctors' operations, during regular and inspection times, like the German study did? Jena and his team could only analyze observable events, including the probability of incidents like patient falls, thrombosis due to inadequate care, and complications from infections during surgery. Surprisingly, there was no difference in the occurrence of these observable events between inspection and non-inspection weeks. I can only speculate that the impact of the Hawthorne effect on doctors isn't as substantial. Perhaps doctors are already dedicated and competent in their daily practices. Having an inspection only results in a few extra handwashes. For patients, the slight difference in the number of handwashes may seem trivial. Yet, this small difference has a subtle impact on mortality rates. The essence of this book is that subtle impacts matter, they can affect lives. As doctors, being careless is not an option. Another study considers that doctors might make mistakes, because they get distracted. As a doctor, your focus should be unwavering when dealing with patient care. Any distraction can lead to serious consequences. But is distraction observable? Jena had a brilliant idea. Examining doctors' birthdays. Imagine you're a doctor working a regular day except it's your birthday. You receive congratulatory messages from family and friends, and you plan to have dinner with them or colleagues. You've already chosen a venue for the celebration. Before surgery, you chat with colleagues, discussing the evening's birthday gathering. Or, to make it to the celebration on time, you perform the surgery faster than usual. And these behaviors yield statistically visible results. Researchers used doctors' birthdays as a natural experiment, analyzing a total of 980,000 surgeries, including 2,000 performed on the surgeon's birthday. Were these 2,000 surgeries different from others? Firstly, patient characteristics were the same, indicating that surgeons didn't opt for easier surgeries on their birthdays. Also, the number of surgeries performed by doctors on their birthdays was the same as usual. The results. Patients who underwent surgery on a surgeon's birthday had a 7% mortality rate within 30 days. In contrast, patients operated on other days had a mortality rate of 5.6% within 30 days. This difference suggests that birthdays do distract doctors slightly during surgery. And, we can imagine distractions from other sources may be even more significant. After all, a birthday is just one factor that can be easily quantified. Now, you might wonder if it's necessary to take measures to prevent doctors from getting distracted. This is challenging. For instance, doctors sometimes make the mistake of confusing medications for two patients in the same room. You might suggest designing a feature in the prescription software to show a pop-up reminder every time a doctor is dealing with patients in the same room, urging them not to mix up medications. However, this wouldn't work. Most of the time, doctors wouldn't make that mistake in the first place. When the pop-up appears, their instinctive reaction would be to close it. It wouldn't serve as a reminder. If chatting distracts doctors, can't we stop them from chatting or create a designated uninterrupted time? This is not feasible because the nature of their work means they often get interrupted, especially when a patient is in distress. Should we forbid doctors from celebrating birthdays or having private gatherings? No, that wouldn't work either. Teams need such gatherings for cohesion. Can we use financial incentives, like rewarding a decrease in accident rates? No, that wouldn't work either. Offering rewards could encourage hospitals to manipulate data, selectively admitting patients, which would be detrimental to the patients. Over the years, the only effective method to reduce medical errors has been to create checklists. For instance, before surgery, requiring all present doctors to go through a checklist, confirming each item one by one. This practice takes little time, requires minimal effort, and has a significant impact. Ultimately, what keeps doctors focused and diligent is their sense of responsibility. Throughout my reading of this book, I've been reflecting on how the authors, through extensive research, identified relatively minor issues. Yes, doctors often make mistakes, but compared to the many irrationalities in the world, hospitals are reasonably well organized. Of course, it's precisely because of individuals like Jena and Worsham, who consistently question and seek improvements, that hospitals are rational places. Yet, most doctors already perform admirably. When doctors meticulously wash their arms, follow various procedures, and enter the operating room, they are incredibly focused. They enter a state of flow. A single surgery can take several hours, even over a dozen hours, during which they forget the passage of time. Real doctors are remarkable individuals, akin to martial arts experts. This book tells us that even the slightest lapse by these experts can result in serious consequences. In the next section, we will discuss doctors' everyday decision-making.
If you feel there is value in this, please like, subscribe to this channel, and leave your thoughts or suggestions in the comments section. Let's grow together and read more good books.